You mentioned that you have an 18-month-old and found out that you're 2 months along and you have had 4 prior C-sections, and you're wondering about what you can do to care for yourself or what you should look for during this pregnancy, now having your 5th, and it will be your 5th C-section as well. And as for birth spacing, you should wait a minimum of 12 to 18 months before conceiving in most cases, but your babies will be born more than 2 years apart. And the importance of waiting, especially when you have a history of C-section, is just to let that uterine scar heal so that it decreases your chances of uterine rupture during a future pregnancy. The chance of rupture is higher if babies are born 12 to 18 months apart. But again, like I said, yours will be about 2 years apart. So generally speaking, a woman with 4 prior C-sections and having children 2 years apart would have about a 1% chance of having a uterine rupture in a future pregnancy. But I suggest talking with your doctor, who can give you tailored information and advice about your risk based on their knowledge of your circumstances. What you'll want to watch for during the pregnancy is incisional pain. This is different than contractions and normal aches and pains of pregnancy. It's experiencing this unusual pain. Some people say it's a burning, some say it's an aching sensation around where the incision would be on the uterus. And if you ever experience this, then call your OB provider and let them know, and they can ask you more specific questions about what you're experiencing and determine if further investigation is warranted for that. There are other things that your doctor will keep in the back of their mind. When a woman has had a C-section in the past, especially multiple C-sections, it puts her at higher risk for placenta accreta and placenta previa. An accreta is where the placenta has attached itself too deeply into the different structures in the woman's body, and this makes it harder for it to detach at the time of delivery, and this puts the woman at higher risk for postpartum hemorrhage, and your doctor can assess your risk for that. A placenta previa is where the placenta is attached itself over the cervix, and this often causes the woman to have bleeding problems during pregnancy, and it does necessitate preterm delivery, usually around 36 weeks, if not sooner, because of bleeding problems. This is something that's checked at the 20-week ultrasound, and if the placenta is anywhere near the cervix, then the woman is monitored and has other ultrasounds in the future to determine where the placenta is around like 28-ish weeks of pregnancy. And it doesn't grow legs and walk up the uterine wall, but as the uterus grows, it can pull the placenta farther away from the cervix and it can clear it. And so again, these are all things that your doctor will keep in the back of their mind because you've had C-sections in the past, and they can give you tailored information and advice about your risk for these complications. Good luck with everything, and if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.